Welcome to the Soleutions Podcast, the show that helps forward-thinking podiatrists achieve greater podiatric success. Here are your hosts, Dr. Michael E. Graham and Mr. Matthew Soul.
Hey everyone, welcome to the Soleutions Soulcast. I'm Matt Soul.
And I'm Dr. Michael Graham.
Today we're talking with Dr. Joel Foster, a double board certified podiatrist and surgeon who made the bold decision to leave the insurance model entirely after over 20 years in private practice. He and his wife rebuilt their clinic around direct patient care. If you've ever thought about stepping away from insurance or just want to offer more freedom-focused care, this is a conversation you won't want to miss. So, Dr. Foster, welcome to the show.
Appreciate it. Thanks for having me.
Of course. So, with such a drastic move of going 100% patient pay, I think we got to start off with what prompted that? What was the impetus to make such a big move?
There's always multiple things, but really the number one driving factor was patient care. When I first came into practicing medicine, and especially when my wife and I started the clinic, our number one goal was we wanted to treat every patient like they were our family members. Like, how would we treat them? How would we want to be treated? And we realized as we kept going on that was impossible, because as insurance made us do more and more work and the overhead was getting higher and higher, because as a doctor, you're the one that's bringing in the money. So you get paid based on how many patients you see. And when you're getting less money per patient and your overhead's going higher, the only way to make more money is to see more people. Well, when you're seeing 35, 40, 45 people a day, like, how can you possibly give good care? And, I would never run in and out of a room in 5 minutes with my mom if she was hurting, yet I'm doing that with all these other patients because I have no choice. I can't survive without doing that. And when we were doing that over and over, we just said, you know what, this is not healthcare anymore. This is processing patients. And we just said, this isn't working. This is not what we're here to do. We've got to do something different. And that was probably our biggest driving force in just saying we got to do something different.
What was that time like when you're making that decision? Because you say that very calmly, like, oh, we just made that switch, but that's a pretty life-altering decision to go and fully cut out insurance. What was going through your head?
We had talked about it for a long time before that, but most of that was because we were kind of getting beat down. We're working harder and we're just like working all these hours. And so we had that conversation before, but when we felt like patient care was dwindling, that's when we were like, okay, we got to do something. We can't talk about this anymore. So the conversation was there. But, to be honest, when we saw that happening, I was at a point, and I've been in practice for a long time, so it wasn't like I'm just starting out and kind of figuring out what's going on. But I was literally at a point that we just said, this is not right. It's not working. We're just going to do it. And to be honest with you, I didn't care at that point. I said, either this is going to be, we're going to do this and it's going to be the best decision we've ever made because it's going to be a better environment for us and better for our patients, or it's all going to fall apart and we're going to shut the practice down. But to be honest with you, that would have been a good decision too, because doing what we were doing wasn't working. It wasn't working for us and it wasn't working for the patient. So either way it went, at that point, I honestly was fine with it. I was like, we got to do something different.
That's a really interesting point too, is that unfortunately, there are so many podiatrists that are out there that are kind of in a similar situation as you, but probably even been practicing for a longer period of time. And instead of taking, that transition to go get add cash services, they're just shutting down. They're just, either going to sell off their practice or they're quitting. And they still have a lot of years left ahead of them that, they could be providing some great care to a lot of people with foot problems. And so that's why it was so fortunate for you to just take that gamble. But again, you could have ended up like, yeah, it didn't work out and whatever, I'm going to go do something else, which would have been a shame.
Right. It would have been a shame, but I said that, hey, whatever way this happens, I'm fine with it. But I was confident that we were going to be successful, not because I'm doing anything magical, but patients want care and they're not getting care. Every patient, I mean, you talk to them, and if you've been a patient somewhere, you go to somebody's office, you sit in a waiting room for an hour, if not more, then you get back, and if you even see a doctor, sometimes you see a nurse practitioner or a PA, but even if you do see the doctor, you're lucky if they talk to you for 5 minutes and they're gone, not to mention the fact that it took you a month to get in there, if even not longer than that. So people are out there that they want care. Anything that we do, we want somebody to feel like we have some value, and even more when it's your health that's involved. So I said, we're going to do something different. It's going to be better, and people are going to appreciate that. I really was confident that that was going to happen. And it's frightening because your whole career, you're basically told, oh, you have to take insurance. If you don't do it, this is how it works. And, nobody's going to come see you. But when there's other places out there, you look at other people that are getting services and insoles and things, and they're getting scammed and they're going in paying all this money. I'm like, if we can do something real that has value, why would somebody not pay?
It's such a radical transformation because the system is so backwards for typically how any other business in America would run, where you start a business, you put a price out there. If customers like that price, then they're going to go with you. But with a third party payer in the mix, they tell you what you're going to get paid, if they're going to pay you, and when they're going to pay you. And you're basically trying to please them, and you're not truly serving the patient or giving them the value they want. So you've kind of cut out that middleman and gone straight to patients and providing better value, better care, more time with them, just a better experience overall that otherwise you couldn't have done before.
Right, it's impossible to do it the other way, and that's what we realized. You either have to pick patients first or insurance. There's not an in between. And so if you want to pick patients, which is what we did, it's easy. That's what it takes, but to make that jump is scary. It's, because you never know what's going to happen. It's literally like starting a business all over again, because clientele, your patient base, everything's going to change. Now, interestingly, you have some patients that are there. A lot of them don't really get it in the beginning, but if you took good care of them before and you explain, hey, this is why we're doing this, even the patients that say, I'm going somewhere else, somebody that takes my insurance, they all trickle back in because they want care. And when they go to 2 or 3 other people that have done exactly what everybody else does and just run in and out of the room with them and give them a shot or give them a pill, and they don't even know why they're taking it, they're going to come back.
What did that process look like? Like, how long was the transition period? Was there a huge drop off in patients? You mentioned some of them were coming back after a while, but what did that period look like when you were making all these changes?
So the transition we did was slow, not really by our decision. I would have just shut it off on one day because it would have been easier that way. But, when you get into all the insurance contracts, you have to, contact an insurance and say, okay, I'm done. In one insurance contract, you have to give them a 30-day notice, and one's 60 days, and one's 90, and somebody else is 120. And then with Medicare, you can only get out like twice per year, like June and December or something like that. So once we sent all those letters out, they just trickled off based on whenever that happened. So it took about 6 months to get off of everything altogether, but that was the process. Now, how did patients handle it and what did we do there? It was very interesting because you always have some patients that are like, hey, I've been with you and I know you give good care and we don't care what happens. We're not leaving. We're staying right there. And that's obviously nice. You want to hear that. And then you have the other patients that again are like, I don't know, let me think about it, or I'll go somewhere else. And then you just give them time to come back because a lot of them do. And then you have some of them that, you they answer you answer the phone and you say you're out of network with your insurance, and it just like click. They don't even want to hear it. They don't care. They don't understand. And that's just the reality. That's what it's going to be like. But I think if you stick with it and give it time, a lot of those patients are going to come around. Again, it's like starting a business all over again. So as those patients, even some of the ones that don't really understand, once the word of mouth starts getting out, because that's really what happens. You get patients in the door and they're like, you know, hey, I went over and saw Dr. Foster, and yeah, he doesn't take insurance, but it only cost me $200, and this is all the stuff that they did for me. Then they're like, oh, because what people assume is when you don't take their insurance is, oh, this is going to cost me $10,000, so therefore I got to go somewhere else. In reality, it's the opposite most of the time. They go to another doctor, they've got an $8,000 deductible, they run all these tests and do all this stuff and dispense them all these things that all goes to their deductible. Then they get a bill later for all this money, and then their neighbor's like, oh, you could have gone to Dr. Foster and it would only cost you $300 instead of the $800 that with your insurance it costs. So you just gotta, let the process play out, let people see how it works, and then they start, they people will start letting other people know.
Did you end up changing your services at all and focusing on something that maybe brings in more revenue in the short term, or were you able to keep somewhat business as usual during that time?
We really just kept business as usual. Now, I thought I started kind of focusing on the orthotic direction because I feel like we do the best orthotics for the lowest price around, and then you have other places that I think are scams and ripoffs, and people are going to all these other places spending 20 times what we charge. And so I was like, well, this is going to be easy. All I got to do is tell people we do this for this price and they'll be running in the door. Well, that didn't happen. Part of it is because I didn't have a huge advertising budget to let everybody know what we were doing. So we were trying to direct it toward that in the beginning because we thought it would be an easy revenue source that would be good for patients, but we did keep all our other services. Now, what we did do is we went and posted on our website a page that says, this is how much everything costs. This is what an office visit is. This is how much x-rays are. This is what an injection costs. This is what these surgeries will cost. Whatever it is, orthotics, heat molded, prefabricated, whatever it is, whatever we do, as extensive as a list as we could do, we put it out there. So then when somebody's looking, they're not overwhelmed and they're not like, oh, well, this is going to cost me $10,000. They're like, oh, $150 to see the doctor? That's not very bad. Let me go see what he has to say. So we found that even though we wanted to go a certain direction, standard stuff was where it was at. And really the stuff that we didn't really push in the beginning were injuries, ingrown nails, things that people are hurting and they want to get into somebody right away. And they call your office and they're like, well, I called 3 people, but I can't get in for 2 weeks. And they're like, and you say, do you want to come in right now? Or do you want to come in this afternoon? They're like, oh, well, sure, I'd gladly pay a couple $100 to get seen right now. And then once they know the service that you provide, then they're going to come back for whatever else they may need.
Super interesting, because I think the perception out there is you have to reinvent your practice. If you're getting away from insurance, you can't do those standard procedures anymore. You've got to get super niche into something. But your story shows that if you want to keep doing it, you just put it out there to the public. And one of the things that also comes up a lot is that pricing side, which I think is one of the hardest things in business, is to figure out what to price stuff at. How did you go about reevaluating all your pricing during that period?
We had this thought of, we want to make our services available to anybody. We don't want to be like this super high tier concierge type thing where like only certain people could afford it. We wanted to make it so most people could afford what we offer. So that was our first thought. And then we also went back and said, from a revenue standpoint, what do we need to bring in on a monthly basis? And then if we saw, X amount of patients and what's our goal here? That's kind of how we guided it. But, I grew up not with a lot of money myself. So I was like, okay, if my foot was hurting, and what's something that I would have paid? I was like, okay, I think $149, $150, that's a reasonable thing. That's something I could afford. Not that I would want to go out and do it, but that's something that most people could afford easy. And then kind of put all our other services around that. And then, surgical procedures. What would this cost for somebody to go to somebody else? And what would it cost for them to go to the hospital? And how can I provide the exact same service for much less, but at the same time be profitable? And if you think it through that way, um, like I said, we were seeing averaging probably at least 40 patients a day before. So I said, let's cut that in half. Let's say 20 patients a day. And if you saw 20 patients a day and your average collection per patient was $250, $250, again, if somebody's going, a lot of people have $100 copays, then they have to pay towards their deductible. If you can do a procedure, an ingrown nail, or get somebody a pair of orthotics, which are going to be more than that, but on average, $250 for 20 patients, you're at $5,000 a day. You see patients 17 days a month, and you do that for a year, you're just over $1 million in revenue seeing 20 patients a day. And you're saving people money. I mean, $250 to see a doctor and get a service is not a ton of money, and you don't have to make a ton of money per patient, and you're clearing $1 million a year. Now, I'm not there yet. We're getting close to that, but I think a lot of people feel like, oh, if I'm going to do this, I got to charge people a whole bunch of money and I got to do all this stuff. And you don't really need to. It's not this like lofty goal of, oh, I got to do all this stuff and I got to do $1,000 procedures and every single person has to get laser packages and all that. I mean, you want that because those people all fit in, but you put it all together, and it's really not an outrageous goal. It really isn't that challenging. Now, it takes a little bit. We're in our second year. Actually, we're just starting our third year now. We've been doing it 2 years, and we're really getting real close to those numbers.
What would you say? Because, so many of our colleagues say, well, in my area, maybe in your area, you can do cash pay, but in my area, my patients, they won't do it. They don't even want to pay the $20 copay or something like that. What would be your advice to them, or how would you reorient their mindset?
Well, first of all, I'd say look at what they're spending their money on, and is there a value? People say, I'm not going to pay for that, but they're driving some crazy car that they don't need. They've got a cell phone that who knows how much money that costs. I mean, look at, I have people all the time that'll come in, or I used to, that come in and, they're like, I don't want to pay my copay, but they got season tickets to the Chiefs game and it costs $75 just to park your car there, let alone the tickets. And there are people that'll come in and they're like, yeah, I don't want to pay. I don't know about that. But then they tell me at the same time, oh, I went to so-and-so's concert. Well, you know how much concert tickets cost? I'm like, come on now, seriously? So I think it's just, people have the money. They just need to know there's a value in it. And the difference is when they're just going to a doctor and they're run through a ringer and they're like, well, of course there's no value for them, so they're not going to want to spend it. But if you give them a service that they're like, oh, wow, that's worth $150 or $200 or $300, it's going to change. And what's funny is you have these uninsured patients that even when I was dealing with insurance, they would come in and they'd be like, well, how much is it? And they would pull out cash. People that just do roofing and working in the fields and whatever. So if you price yourself right, it's not, again, if I said, oh, an office visit with me is $2,000, yeah, you're going to not have that. But I don't think there's any area that you're going to have. I just don't buy it. I just think, people always say that, but I don't believe it. If you tell them a price and if you can let somebody know there's a value and then they come in and see it and they start telling other people about it, it just what is it worth to them? And if you're doing things the way that you've been doing it, it's probably not worth it. They're not going to want to pay that. But if you do something different, they're gonna do it. And think about it. If there's a whatever it is, a restaurant, a grocery store, if you go into one and it's all run down and stuff's falling off the shelf and you go up to check out and they're like, yeah, it's $20, pay me now. But you go to another store, it's clean, it's nice. The person says, oh, welcome, come in. How can we help you find something? And they're selling the exact same product. Even if one's double the price, which one are you going to go to? You're going to go to the one that you feel like gave you value. So as long as you are providing a service that has a value that somebody thinks is worth that, it's not challenging. It's really not a challenging concept. It is because we've been told that it should be, but it really isn't.
How about those conversations with patients when they're asking about that and it's a little bit of a switch for them? Was that tough to navigate, or as you explain that value side of it, do you feel like patients pick it up pretty quickly?
They do. I mean, some of them don't get it. Some of them aren't going to. Some of them are going to be like, oh, I'm going somewhere else, and that's okay. But if you say, the reason I'm doing this is because I want to give you better care, that's why I'm doing it, which is absolutely true. And then they see it. Just the simplest things, like if somebody came in and they have an ingrown nail, and you run in and you're like, oh, you got this ingrown nail, we're going to give you a shot, I'll be back in and we're going to clip it out. Or if they come in and see you and you say, oh, I've got this ingrown nail, and I said, yeah, you do, but let's check your pulses, see what those are like, let me check the nerves, let me see what those are like. And then you say, you know what, I see you've got this ingrown nail, and here's the options that we can do. We can give you an oral antibiotic. It will help the infection, but it's probably not going to resolve it because the nail's ingrown. I can do a temporary nail avulsion, and this is how that works, and it's going to resolve it, but the nail could come back and do that again. Or we can do this permanent procedure where it doesn't come back. It's going to take a little bit longer to heal, but you should never have to deal with it again. This is how each one of this is what this costs, this is what this costs, this is what this costs. What makes the most sense to you? And they're like, my goodness, nobody's ever done that before. Nobody's ever even explained my options. I went to a doctor and they signed me up for surgery and I didn't know why I'm doing it. So as soon as you take your time and explain it and you're educating the patient, letting them be a part of the process, immediately they see the value because nobody's ever done that, and they're not going to find anybody else that's going to do that.
That brings up another interesting point too about patient participation in their care. Like, and what I mean by that is if it's covered by insurance or versus they're paying for it themselves, do you think that they take a more active role in their recovery and their treatments and things like that?
I do, for a couple reasons. One, because they understand what they're doing. I can't tell you how many patients that have come in here, and I might even tell them to do the exact same thing that 3 other people have been telling them, but I'm the first one to explain why. So as soon as they understand the why, now they're going to be more compliant because they understand why they're doing it. That's the first thing. But the second thing is, yeah, now I have some money involved in this and I'm going to be compliant to get better because I don't want to spend any more money. Or we're going to start with this treatment plan, and I say, hey, we're going to start here. If it's not getting better with this, we're going to end up doing surgery. And this is what that costs. And they're like, oh, let's do this and let's get better. I think because the investment that they've made, that's a big emphasis behind that. But what I found, what I didn't expect in the beginning, was just me taking the time to explain. That's been more helpful than anything, because that's what they go, I see now, I understand why I'm supposed to do this. Because you didn't tell them what to do. You didn't say, okay, we're going to do this, come back in 2 weeks. You said, here's your options, here's how they all can play out, here's the pros and cons to each of them. What makes the most sense to you? And they're like, oh, this one I think is where I want to start. Let's do that. And now they're part of the decision-making process. So they're like, oh, I'm helping myself. I'm getting better because I know what I'm doing. So there's really multiple approaches, kind of thought processes on that.
With the the freedom and more time you're getting, obviously that's a huge impact from you if you're going from 40 patients a day down to 20. But what does that look like with the rest of your staff? What is their life like post going to cash pay? What's the overall impact to the practice?
It couldn't be better. I mean, just for my own peace of mind, it's just a game changer. I thought I was a good doctor before. It's drastically different. My patient care has skyrocketed because I have time to talk to people. So that my stress level's down. I'm not thinking about the 20 people I already saw because I haven't seen 20 yet. It's just like I can take my time. It's slower. Everything is just calm. And then the staff is the same way. They're like, you're not like trying to check three people out and answer the phone and get somebody's copay and find out what insurance. And that's the other part of it is every single patient that comes in the door knows that everybody just wants to get them better. I don't care what insurance you have. My staff doesn't even, we don't, that's not even on the radar. We're not asking MIPS and MACRA and how many times have you fallen and do you have a living will? And I don't even care. So the staff is like only asking patient questions that help them. So they're calm, they're slower, they're relaxed, they're enjoying it. They don't have to worry about, oh, did I miss to ask a question or any of that. I mean, the staff loves it. And sometimes we'll just sit there and go, remember when we asked all these questions and now we don't have to do any of that anymore? Can you believe that we used to do X, Y, and Z? Before I gave somebody a brace and I had to fill out 4 forms and this one was for Medicare and this one was for private insurance, and they're like, all that's gone. And it's just night and day difference for everybody.
Are you still doing any of that documentation? Do you ever have patients that try to submit like, hey, I went to see Dr. Foster, see if their insurance will cover it, or you just got rid of all of that?
No, I try to document. I mean, I try to stay on top of kind of how things are supposed to be as far as documenting it. And I do, just like everything else we do, I want everything to be like A level. So we still put the codes in and we still do all that. And we try to make it so if somebody wants to submit a claim on their own, we'll give them the forms and it's in there. Am I really focused on it? Not really. If somebody comes in and they had a fracture and it's the subsequent visit or whatever, do I really care if it's the A or B or whatever at the end of it? Not necessarily, as long as I have the fracture and what toe it is. Now, if somebody comes in and says, hey, I tried to submit this and it didn't work, I'll just go in and switch the code and give it to them, But for the most part, we try to, document like our charting as far as how we do it. I think is top notch. In fact, I was over at the surgery center and the director of the surgery center came over and to me and said, we were just talking about your notes and how great your notes are. We need to get all the other doctors over here to chart like you do. So our documentation I want it to be like when somebody gets a copy of their note, they're like, oh, wow, I know everything that he did. And when I send it to a primary care doctor, I want them to be like, oh, man, this is good. He's taking care of the patients over there. The coding sometimes is not perfect just because I'm trying not to focus on all that. I just want to get the patient better, but it's pretty good.
For those podiatrists out there, they're interested in maybe increasing cash pay services or going the journey you went on and going 100% cash pay. Do you have any advice for them as they're looking at what that future would look like?
Whatever way you want to do it, just do something because, the way I look at it and was seeing it at the time too is, let's be honest, the insurance companies do not care one bit about you and they don't care about the patients at all. Their number one driving force is making them as much money as possible, and they're going to do that by raising rates, denying people services that they need, and paying the doctors less. One part of it went for me, I was like, this is wrong, this doesn't make sense, but at one point I said, I'm just as much to blame because I'm doing the same thing. I'm saying okay. It's like somebody punching you in the face and you say, ow, that hurts, but keep on doing it. At some point you say, wait a second, why am I even doing this? I'm actually perpetuating the problem by telling people this is the only way you can get better. So if you really, look at it that way and say the only way to change is to step out and say, we have to give people another option, because otherwise we're just as much to blame as the insurance companies, because we're the ones that are letting it happen.
It's such a scam. Just how did this ever happen? It's where you go in and do this great surgery on a patient, or whatever the treatment is, but just, using the surgery, do a great
Yeah.
bunion correction, and patient is thrilled and happy. And then the insurance company comes back and says, oh, by the way, you didn't dot this I or cross that T, so hand it back over. And you're like, wait a minute, the patient's
Yeah.
doing great. Here's the pre-op, here's the post-op. Their quality of life is amazing. Nope, hand it over. Thank you very much. So it's
I know
so
it
crazy.
doesn't. Yeah, but again, we're all compliant in it because we're
Yeah.
like, okay, here's your
Yeah.
money
Here's your check.
back.
Yeah.
What,
Yeah.
and you can't do anything. You can't really fight it. But yeah, and it's on the backs of obviously the patients that are paying the premiums and not getting anything. But you went to school for 8 years at least, and then you're doing residency, and you're, working your tail off. And like you said, you've worked all day long, and then you go to the hospital and you got somebody with, pus running out of their foot, and then you're doing that at 9 o'clock at night, and then if you're lucky, the insurance pays you anything, or they go, oh, here's $200 for draining that foot in the middle of the night.
Right.
You're like, what? Who would even do this? I could go wait tables and make better tip money than that. Yet
Yeah.
I have all this overhead and malpractice insurance, and I went to school all these years for that. It just doesn't make any sense. And from the patient standpoint too, like the doctor has no incentive to do anything differently. Like why the doctor that basically does a horrible bunion and the doctor that does a great bunion get paid the same amount? It doesn't even make any sense. There's no logic in any of it. But everybody from a patient has been told over and over, this is how the system works. And doctors have been told over and over, this is how the system works. And it is how the system works. So get out of the system and just stop. That would be my thing. It's just you're perpetuating it until you just say, I'm done. And we did it, and I even stepped out. I don't even carry traditional insurance anymore, and that's a whole different story, because there are tons of, like Crowd Health and Sedera and Christian Health Share and like all these things that you can join that are pennies compared to traditional insurance. So it saves you money. And so, I think at some point we just need to all get out of that. But anyway, I can go on forever because it drives me crazy. It's frustrating, especially when I've spent so many years of my life working crazy, crazy hours. I mean, I used to get into the office between 4:30 and 5 every morning, and I was lucky if I was done by 9 o'clock at night, just trying to get charting done for years. And I was like, I'm almost mad that I kind of let somebody do that to me. But again, it was my choice. And so now I finally made the choice and said, I'm just not doing it. I don't want to participate in that. And think about if you treated your staff that way. How much staff would you have if you did that to them? If your MA accidentally wrote right foot instead of left foot in the chart, and you said, you know what? I'm sorry, I'm not paying you for today because you wrote right and it should have been left, so I'm not going to pay you. How long would they stay around? You wouldn't have any staff, but somehow we just keep coming back and saying, oh, let's keep doing this again. Take the money, don't pay me anything for the service, but I'll come back and do it tomorrow. It's illogical, but since you've been told that's the way it's supposed to be, you don't even know what else to do.
If you had to do it all over again, would you do anything different?
I would have done it a long time ago. That's the first thing I would have done. And I would have probably not spent so much money, because in the beginning I was like, okay, I got to get my name out there. I'm going to get a billboard and I'm going to do a radio ad. And I'm going to do all this stuff. And it was a waste, to be honest with you. It would work if you had this money to sustain that, to really just keep getting it over and over. I definitely would have done it a long time ago. I would have kind of just looked at what's the minimum budget I need to function, and drop down to that. And then I would have just started doing some word of mouth, like going to Doctor's offices, there's so many. If you look in your area, there's going to be tons of direct care, primary care. They're the smartest ones. They've been doing it for a long time, and there's a handful of them around here. So go connect with them and get your name out there and say, hey, I'm a podiatrist. I'm doing what you're doing. This is how we're doing it. And that would be an easy way to get your name out there, but also your referring providers that you've worked with in the past. Now there's some of them that just don't send me patients anymore, but I have some that are just like, they have my cards and they're like, hey, we've been working with Dr. Foster for years. We know he's good. Yes, this is what it's going to cost you, but I'd go there if I were you. Or, hey, you can go down and see him for your ingrown nail and he's going to get you in today, or you can work with your insurance and they can get you in 3 weeks. Here's your options. Even the providers that just work with insurance, if they know who you are and they know you give a good service, because that's what they want for their patients. And honestly, they all wish they were doing the same thing. I mean, they're like, oh my goodness, we got to do what you're doing. But I would have done more, just get out there, let people know what you're doing, keep following up with them. And it takes a little while. I'm not going to say I've just been swamped busy every day. And in the beginning, I was like, okay, we saw 2 people today. But even the 2 people that you saw, it's such I don't know, I can't even explain what it's like, because you suddenly feel like I actually have value. Somebody's actually willing to pay me money to come see me. And it just gives you a whole different mindset, because you're used to seeing all these people that complain about paying their copay. And now somebody's coming in and saying, I'd be happy to pay you money to help me. And now you've given them a value and you feel like you have value back, because nobody's ever given you that before. So it really, you're like, it encourages you to just keep on going. And, if you just stick with it and do right for people, that's really what it is. And that goes back to what I said in the very beginning. I want to treat people like they were my mom, my dad, my brother, my sister. What would I do? Or if it was me and that was my foot and I had that problem, what would I want done for myself? And that's the way we do it, and it works.
That's really great advice. For those listeners out there that want to connect with you or learn more about your story, what's the best place for them to reach out?
Well, of course, get on the Soleutions, join Soleutions and get involved, because that's where, first of all, you can connect with me for sure through that way, but that's how we're going to grow this. And that's how I'm going to get better, by seeing how you guys, other doctors, how are they doing it? What can I learn? And the more that we can, kind of get together and network and try to build off of, the good things that people are doing and the mistakes people have made, and say, let's all get together and let's join, because really that's what Soleutions is all about, is let's work together and get as many people out of this insurance nightmare as we can and start getting patients better.
Appreciate the shout out. We did not pay him to say that, but I truly appreciate it. A big thank you to Joel Foster for sharing his story and insights with us. If you found this episode helpful, hit follow or subscribe and leave us a quick review so more podiatrists can find the show. If you're ready to grow your cash pay services, build better systems, and explore a hybrid or full cash pay model, follow what Joel said and go over to solutionsdpm.com. That's where our community tools and training are all focused on helping podiatrists grow smarter. Until next time, keep on growing.
Appreciate it.
Thanks, Joel. You are a rock star.